So I'm just going to take you through a few important tips that you probably will want to know before you start your PD exchange. So the number one thing is make sure you're washing your hands. As you can see, I made the thumbnail for all of these PD videos as just a nice reminder that you need to be washing your hands. Anytime you're changing gloves, accessing the line, going in and out of the room, make sure you're washing your hands. Another important thing is, where do you get a PD cart? So they have these carts already stocked with the essentials that you'll need for this process. So if you're working during normal business hours and the stockroom is open, feel free to just go down and get a cart from them. If it is after hours for the stockroom, you're going to reach out to nursing supervision or security, and they can help you get a cart from the stockroom. You're going to want to get a daily weight for these patients prior to the first exchange of the day, and then make sure that's documented. We need to track that day after day. So get that before the first exchange and then make sure it's documented. You'll also get vital signs prior to each exchange. This just gives you a baseline to work with so that if during the exchange the patient starts to not feel good, or you're concerned, or something comes up, you have something to compare it to. Now, the PD carts should have a heating pad. If not, they also have those in stockroom. And the solution should be warmed prior to you instilling it into the patient's abdomen. So if you have 4 to 6 hours between exchanges, if you put this next solution that you're going to use on the heating pad and you put it on medium and leave it for that 4 to 6 hours, it should be warm enough, but not too hot for the next exchange. Say the patient just arrives to the ED and now you need to do an exchange and you don't have a ton of time, you can just put it on high and it shouldn't take that long and it will warm it. Just double check ahead of time to make sure that the solution isn't too hot prior to you instilling it into the patient. Another important tip is that some of the patients come to the ER with a Fresenius catheter. There's two types of products, Fresenius and Baxter. All of our PD products are Baxter. So we have to take their line and modify it from a Fresenius into a Baxter. So double check that before you start your exchange and just see if you're going to need to complete that process. One other thing that is important is you need to actually track the time that it takes to drain the patient and to fill the patient. So you should be documenting, you should be noting the time when you first open the catheter to start the draining process and when it finishes draining. Same thing when you go to fill the patient. If you watch the video about documentation, you will see that there's a slot for time to fill and time to drain. How long did it take? So make sure you're keeping track of that. And then obviously after you've completed the exchange, you're going to go ahead and complete all your documentation.